Morning, morning, morning. Yes, we're back with another episode, another lovely rider. Today we have Cassie all the way from overseas, and she's been here for studying her masters, and now she's going home, and she works in global health. So we're going to just have a conversation about, just let it flow and see what she thought of England and what her industry's like back home in the States. Nice to have you here today, Cassie.
Thanks for having me.
First of all, how do you find this city?
I love London. You know, it's the biggest city I've ever lived in. And I lived here when I was younger, when I was a kid. So there's always part of it that feels like home. But yeah, I love the hustle and bustle. I love how global it is. Like you can go walk down the street and meet people from different cultures or, different religions, different everything. And that's so different from where I grew up. And so yeah, I love London.
Okay. What was before you came here, what was your impressions of London to what actually you saw it to be?
Oh, that's a great question. I think in the US, especially, there's just kind of this idea that all Brits are really posh and really sophisticated, and then you come and we were here for the Euros last year, and that's not always the case. Brits can get quite rowdy.
We put alcohol in us.
Yeah, absolutely. But yeah, I don't know. I think that's kind of the general impression. Driving on the wrong side of the street is always hard to get used to,
Mm-hmm. Okay, on the wrong side, huh?
Yeah.
So you've been driving when you're here, you've been cycling while you're here?
Mm-hmm. Yes, yeah, both harrowing experiences for sure.
Is where you come from, is that a town, a city?
Suburb, probably.
Suburb.
I would say.
Okay. Yeah. I'll give you a little fact. London's officially classed as a forest.
Really?
Yeah,
interesting.
Because it has more trees per square mile than that you would need under the UN law to classify something as a forest.
Huh. Yeah, there are a lot of trees here. It's very green, which is nice.
And that's because obviously the Great Fire of London and the industrial area in that respect. Mm-hmm. So you came over here to study. Why London?
So, like I said, I lived here when I was a kid, and so we have some family ties here, which is nice. It's not super difficult to get to and from my home in Denver. And yeah, it's cheaper to get a master's here than it is at home. And I was looking around at a few programs, and I found one at UCL that I really was excited about. So that's what led me here.
Okay. So why global health?
I've always been interested in health. And so when I started uni, I thought I wanted to go to med school to be a doctor. And then I didn't quite really get on with the hard sciences. I was good at it. I made good grades, but I didn't like the way that you just had to regurgitate your answers. There's not a lot of room to think outside the box. You just have to think the way the teacher wants you to think and reproduce their answers. Essentially, you couldn't really think for yourself. So I thought I was going to do medicine for a while, and then I decided against it, and I switched my degree to women and gender studies, actually, because I figured, I could still go to med school with that degree, or I could do something else. And so my first job outside of uni, I worked for a women's health clinic doing some education and outreach for them. And so I was able to get involved in health that way. And then I realized, I was like, oh, okay, there are other ways to do health, like doing public health or doing global health, kind of the more social science-y part of health, thinking about how these health systems really impact people, and how that interacts with things like gender, race, and class. And that's what I'm really interested in, and thinking about how to promote and protect people's health and care for them.
So the social impact.
Yeah, exactly.
Are you still a specialist in the women's field then? Is that what you're focusing on still, or?
Yeah, I wouldn't say I'm a specialist or an expert, but yeah, I definitely have a background in it, and I really enjoy thinking about things from that way.
Okay, that's good. So the route that you took, would you still say take the same route to get into that career if you were advising a younger person?
Yeah, I think what's tough is, thinking back to my time at uni, is I thought there was only one way to do something. Like I had to be a biology major because that's what got you into medical school, and I had to do this and I had to do that. And I was just like, well, I kind of realized, I was like, I don't even know if I really want to be a doctor, and so I think taking I think I would have taken the same path because I think I learned a lot. I learned a lot about a lot of different topics. I learned a lot about myself. But I think one thing I'd say is that for like kids going into uni, I think there's so much pressure to be like a doctor or a lawyer or a banker or, these high-powered careers. But if that's not like who you are, then that's fine. Like you should just do what you like, what you're passionate about, because, what brings you joy and stimulates you and all of that. So
Okay,
yeah,
that's good. What have you learned about the industry that you've been in that you wish you knew when you started?
oh gosh, that's
And I would also ask that question in relation to living in London.
oh, okay. I guess I'll answer the job one first. I think one thing that's helpful to know is that no one really knows what's going on. Like everyone, it's okay, and it's okay to ask questions and not know things, because I feel like for me, I just really wanted to pretend like I knew everything, and I didn't want to ask questions because then that would mean that I wasn't smart, or like I wasn't paying attention or whatever. So I think learning that everyone's just kind of figuring it out as they go, and it's okay to ask questions from other people and to be unsure. And like, just because I'm out of school, that doesn't mean you can stop learning, and one way to learn is to ask questions. So I'd probably give that advice. And what was the same question for London?
The same question to London, yeah. As if another American was going to come to stay in London and study, what would be your advice to them?
Oh, good question. I think just enjoy it. Like, enjoy the free healthcare. Get all your appointments in while you can. But no, just enjoy being in such a vibrant city that's, it's so similar to the US in so many ways, but also so different. And I think just really trying to enjoy it, And it's tough because even though it's similar, you do kind of feel like an outsider sometimes. Like, I think there are a lot of, not misconceptions even, but just like you say you're American and people are like, oh, so you're this and that and the other thing, and just trying not to let that get to you.
So when you there's a story there. So when you say, what response have you had when you said you're American?
People will think that I'm dumb. People will think that I love guns and God and glory, and I'm super, like, the stereotypical, like, American patriot. And, like, don't get me wrong, I love my country, but it's not great right now. But part of loving something is trying to make it better, right? So, but I think it's just, a lot of people reply really condescendingly, like, they're like, oh, so did you vote for Trump? Like, did you... and they think it's kind of a judgment on me that I'm American. And I'm like, I don't agree with those things, like, anyway, so I think there's a lot of preconceived notions or biases or, about like what an American is, and, the stereotype that we're loud, which is true, but we're also, I don't know, it's anytime you try to make one person into this thing, like, people are complicated, it's hard to stereotype anyone because people don't fit neatly into boxes,
We have trends, common traits,
right,
with thing, but it doesn't mean that you're definitely that.
Yeah, exactly. So trying to not listen to people when they try to put you in boxes, I'd say. Yeah.
Okay, I hear you. Well, we won't get political on that side of things. So, what would you say to your 16-year-old self?
Oh, I've actually been thinking about this a lot lately. I think I'd tell her that everything will be okay. Because like I said, kind of figuring out what I wanted to do, there's just this notion of like, this is what I thought was expected of me, and I had to do really well on all my tests and get good grades and do this and that and the other thing. And I think just trusting that it will all be okay, like it will be, and trying to trust that a bit more, providing that comfort.
So my mind just went blank there.
Oh, no worries.
What does the future hold for you?
Good question. The idealist in me says that I want to change the world. I don't know how I'm going to do that, but I think it's the idealist in me that wants to change the world, and I think the realist in me that's like, if I'm going to change the world, it's not going to be glamorous. Like, it's going to be a lot of emails and meetings and spreadsheets and all that. That doesn't mean that it's not important. And I think just, I don't really know what exactly the future holds, but I want to try to make the world better, like make it a kinder, more inclusive place where people have the social support that they need and people are treated with dignity and respect. Like, that's the world that I want to work towards. So, yeah.
You've touched on quite a few points there, and it's a little bit of a rabbit hole we'll go down.
Sure.
We've got some time. You deal with, like, global health.
Yeah.
Do you deal with the mental side of health as well?
Yeah, I think that's something, not quite in this, a little bit in this work, but it's something that, I've done work in before.
Okay.
Yeah.
What's your opinion about mental health today? Because some people say the new generations are very weak and everything's a problem and they're very entitled, and therefore those are the catalysts which puts them in the state of mind that they are today, issues. And other people say no, they need to be more in touch because the younger generation are, a different breed of people and they understand themselves more, or they're getting to know themselves. What would be your take on that from obviously a professional point of view?
That's a good question. I think my first instinct is to say that I don't think these things are new. I think they've always been there, but people are just talking about them for the first time. And I also think, like, young people are just dealing with such a different world than, people my parents' age were dealing with. We have, like, a period of, like, a pandemic that's lasted 2 years. We have, like, a lot of political instability, climate change, things like that. So I think it's valid that young people are expressing more of those things, and I think it's good because I think for a long time we just kind of have this idea that it's better to just, like, push down whatever you're feeling and just be, like, happy and fine. But I don't think that's healthy. I don't think that's good. I think, I think at the end of the day, what it comes down to is I think we all want to be loved for who we are as people. And in order to do that, you want to feel comfortable with someone, like, sharing your fears and your anxieties, or when you're having just a really shitty day, like, you want to have people that you can count on. And I think part of what I hope that we're moving to is a society where we can do that and people are met with, like, love and acceptance rather than judgment. So that's my take.
But we will always judge people, though.
Sure.
Would you say that?
Yeah, sure. I think it's kind of natural to judge people, but I think there's a way, you can kind of think about it like, yeah, you have this instinct to think one way or the other, but then you can retrain it, or you can say, okay, yeah, I'm making this judgment about this person. Why? Like, what is it about it that is making me judge them?
Okay, so you're saying the person who's making judgment should reflect on their own actions more than the person who's doing. I suppose if the person who's doing the activity doesn't see a problem in what they're doing, then they're not going to have anything to say in that respect.
Well, of course, it, like, depends on the activity,
Yeah,
like.
True. What's the biggest global health issue that you have found so far, barring the vaccine and the vaccinations and COVID, barring COVID?
Sure. I think health inequality, like, thinking about how they're called, like, the social determinants of health impact people's health. So, black mothers in the U.S. tend to have a much higher maternal mortality rate than white women. And so thinking about how these things like gender, race, and class can impact a person's health outcomes, I think is something that we're starting to talk about more, but for a while went really unacknowledged. And I think thinking about how those things, who we are, kind of our identities, can impact things like our health and our lives important, that just really kind of thinking critically about how that has an impact.
Would you say it's a case of the doctors, the equipment, or what? Because what came to mind there is when I lived in Kenya, most doctors are black.
Yeah.
I don't know the mortality thing there in that respect, but obviously the population grows 1 million a year. Fuck, that's a lot of people.
Yeah.
So maybe would they need those kind of situations in? Would they need more black doctors in America, stuff like that, black midwives? Do you reckon that would help the issue?
Sure. Yeah, I think the thing about representation is that whenever you bring people who look like you into the playing field, like if you see a doctor who looks like you, who's had a similar life experience to you, then they're more likely to believe you and take you seriously. Like they can relate to you, they can empathize, and I think that is so important. And so I think it's that, and then just trying to listen more and trust that people know themselves and know what's going on, and that trying not to discredit them and meeting it with humility, and working as a team. And it's not just doctors. I think it's the whole health system, trusting people to do what they want and know what's best for them.
Mm-hmm. I hear. That's very interesting. If you could change one thing, you've got the magic pen, for the funding, you've got the power, you've got everything. What would that thing you would change within your industry?
Oh, in the industry. Interesting. I think I went to this talk the other day, and they were talking about how you really need to work with local communities and hold yourselves accountable, blah blah blah, and those are all great things, not blah blah blah. But then I see a lot of people talking the talk, but I don't see them walking the walk. I don't see them actually practicing those things, listening to local people, listening to the people that they're trying to help, building coalitions, and so I think maybe just practicing a bit more of what they preach. We're preaching these things, all these principles that I agree with, like equality and sustainability, but are we actually doing it? And just trying to make it so people follow through with their promises.
Okay, that's good. You've been a great guest here. My last question to you, at Taxi Chronicles, correction, we believe in sharing our gift. You've just done that in sharing your journey of life, and therefore people can learn from this experience, your experience, which is great. What I'm asking you now is, give us in one sentence, if the world was in front of you and you was going to give them one key piece of advice based on your life experience so far, what would that sentence be?
That's a good one. Hold on, let me think for a second. Oh man, yeah, I'm stumped. I think I kind of want to say just as long as you're not hurting anybody else or yourself, do what makes you happy. Okay. Life is short. Do what you can.
Fair enough. Well, we wish you well, and we thank you again for the interview.
Yeah, thank you so much.
We hope that episode enhanced your life. We post an interview every day, as well as vlogging on our social media channels. Don't forget to subscribe to get our latest episode.